Have you been diagnosed with breast cancer and you're considering breast reconstruction? If so, in this video, I'm going to share with you the top 5 questions my patients asked me during that initial consultation. Hello there, my name is Dr. Wai-Yee Li. I'm a board-certified plastic surgeon specializing in breast reconstruction and breast rejuvenation. I've personally performed several thousand breast reconstructions. I'm originally from London and I now work in Los Angeles in a busy cancer center. In future videos, I'll be doing a deep dive on other really important topics on plastic surgery for the breast. So here are the top 5 questions I get asked by my patients during that initial consultation. Number 1, is breast reconstruction covered by medical insurance? The good news is, here in the US, medical insurance does cover breast reconstruction, and not only the side that has breast cancer, but also the other breast in what we call symmetrizing surgeries. The second question I get asked a lot is whether or not breast reconstruction is mandatory. The answer is no. However, we do know that breast reconstruction brings several benefits, including better body image and self-esteem, and also better for wearing clothing in terms of symmetry, and you don't need a prosthesis. So the third most common question is who should get breast reconstruction, or who will benefit the most from breast reconstruction? Well, the fact that your breast surgeon has referred to see a plastic surgeon means they're either planning on a mastectomy where they're taking away the whole breast, or a lumpectomy where they're taking a large area of diseased tissue and they're going to leave some healthy breast tissue behind. In those circumstances, a plastic surgeon like myself can come and rearrange the leftover tissue to give you a nice breast shape, either doing a mastectomy, which the breast lift, or a breast reduction, where they're not only lifting the breast, hiding the defect, but also making the breast smaller in size. The fourth question is, who should not get breast reconstruction, or who's a poor candidate for breast reconstruction? So when you meet with a plastic surgeon, we typically would go over your medical history, your surgical history, go through what medications you're taking, and also other things such as your social history. Certain things will make you a high risk to developing complications after surgery and therefore a poor candidate for reconstruction. These include a high body mass index or low body mass index, other medical problems such as diabetes, because that increases your risk to getting infection if you're poorly controlled. The big one for me is really active cigarette smoking. If you're a smoker, your risk to not healing is very high. And we'd either tell you to quit smoking for about 4 to 6 weeks, in some cases 8 weeks, or we are not going to offer you breast reconstruction because the risks are simply too high. So the fifth and final question is, what happens if I don't get breast reconstruction? Well, one of two things. Number 1, your breast surgeon is going to simply close the wound and plastic surgery does not get involved. Or number 2, you can request that a plastic surgeon does an aesthetic flat closure. The way I do aesthetic flat closures is that on the day of surgery, I will meet with your breast surgeon before you go in the operating room, and we will carefully together plan out your incisions. And this way, this allows them to do maximum exposure to do their part of the surgery and yet allow enough tissue so that you have a good closure. And when they're done with the mastectomy, I will come and meticulously close things to give you the best possible aesthetic outcome. It's really important to make the right decision up front, because trying to fix things afterwards is way harder. I know, because I've done it many times. I hope you have found this video to be useful. If so, please hit like and subscribe to my channel, and I'll see you at the next video.